I talk to a lot of physicians, and a lot of physicians want to know, why should I care about social media?
Mhm.
And I only hear negatives about it. I hear people getting canceled, people getting fired because of social media, and a lot of physicians see social media from a perspective of risk, right? They always hear it from their risk managers that don't do this, don't do that, you get fired, and it's very restrictive, right? So I just wanted to present an alternative viewpoint saying, hey, social media has brought me to where I am today, and there's actually a lot of positives. And I actually go one step further. I think that physicians should have a responsibility to be on social media in a responsible way because
Welcome back to the channel. I am so thrilled, honored, privileged today to have with us Dr. Kevin Pho. Many of you will know him as the founder, the owner, the editor of KevinMD. So, KevinMD is a leading social media platform. It includes the big blog as well as the newer podcast. He also is a speaker and he coaches. He is a co-author on the book, and I have the title here is Establishing, Managing, and Protecting Your Online Reputation. It's a social media guide for physicians and medical practices. So, Kevin, thank you so much for sitting on the opposite side of the chair today and coming to share your story, your voice, and your insights.
well, thank you so much for having me on. Excited to be here.
Yes. And I really want to know, before Kevin MD, can you tell us your story about what kind of brought you towards medicine and the beginning of Dr. Kevin Pho?
Boy, before Kevin MD, I have to
Yeah.
really think
Mhm.
back because that was almost 20 years ago. So I had a pretty traditional approach to medicine. You always want to go into medicine to proverbially help people, right? To make a difference in people's lives. And I thought that being a doctor and doing some of the shadowing that I did, and you realize such an impact that physicians have on their patients' lives, and the trust patients place in physicians, and the secrets that they tell them that they wouldn't tell anybody else. And I think that was a tremendous responsibility that I really relished in having, and that really led me to my journey towards medicine. And I graduated medical school in 99. I did 3 years of internal medicine residency, finished that in 2002, and wasn't quite sure what to do next. And I finished residency. I was thinking, oh, maybe I do a fellowship, but I ended up taking up a primary care job in Nashua, New Hampshire. It was my first job out of residency and didn't quite know what I was getting myself into. And I realized that it is something that I did enjoy doing. I liked talking to patients, of course, about the variety of issues that they have in a primary care setting. And honestly, I've been doing it ever since. I've only had one job out of residency, and that's that primary care job that I had after I finished. And I don't quite do it as much as I did back then. Of course, there's Kevin MD, the platform and the website and the podcast, and that's taken up a lot of my efforts as well. But I think that having those concurrent journeys, having that traditional internal medicine primary care practice, along with all the other new stuff that I do on Kevin MD that I didn't get trained in medical school and residency for, whether it's running a website, doing a podcast, and speaking and coaching, that's actually kind of fed each other and has kept me going till today. So that's essentially where I am, and I think we're going to get into in terms of all the other things that we do.
Yeah, absolutely. And looking back towards, in 2004 when you were starting Kevin MD, and it seemed like, it's so important that you do have that background where you are, in the trenches per se, because in social media, a lot of times the narrative can be run by people that really haven't been a physician or really had the exposure on a personal level. And I understand that's kind of what your impetus was to start your social media presence. Is that kind of how it started? Or can you share with us what happened in 2004 that was like, I really need to step into the social media scene?
So it wasn't any big plan. I can tell you that right now. So I think right now, if a physician were to go into social media, they have to come with a plan, pros and cons, and the amount of time that it would take, the amount of commitment it would take. But back in 2004, there
Mhm.
wasn't really any social media, right? There was no Facebook, and I think there was maybe MySpace or something like that.
Oh my gosh,
Um,
MySpace.
I know.
That's hilarious. You know what is funny about MySpace is
Mhm.
I Googled something and one of my pictures came up. I'm like, that's like my high school senior
Yeah,
picture. And it was my MySpace profile.
yeah, MySpace,
Wow.
right?
How
And before
crazy.
then, there was Friendster. Remember Friendster?
I don't even know that, you
Friendster was
know?
like the precursor to Facebook, but
Oh my gosh.
I didn't have a plan back then, right? So I think that there were blogs, definitely. I think that the number of physicians who were blogging probably was fewer than 50 to 100. And someone said, you have a lot to say about medicine. I always have my opinions about what I think should happen in medicine. And I think one of my friends said, you should start a blog, right? So I started KevinMD and didn't quite know what to expect. I would comment on some stories that were published, and patients would ask me questions all the time in the exam room about, this study came out, what should I do? And I think that one day there was like a medicine recall. There was Vioxx, right? That anti-inflammatory medicine that Merck recalled, and had a lot of patients on it. And I would write a blog post on it and say, this is what you should ask your doctor. These are the questions that you should consider. And I think the next day or the day after, in the exam room, someone actually had a copy of that blog post, or they mentioned that blog post. They said, Dr. Poe, I read your blog post this morning, and that was really comforting to hear what you had to say about it. And it was good to have that physician context to the news that I was reading in the newspaper. And I think that was really that first instance where I realized that as a physician that we could talk to patients not only one-on-one in the exam room, but also one-to-many on what is kind of the beginnings of social media, like a blog. And of course, that's evolved. There are so many different ways that we can connect now, for better or worse. And I'm sure we'll talk about some of the many cons of social media
Mhm.
later on. And then there's different mediums, Facebook, Twitter, LinkedIn, you have video. Now I have the podcast. So many different ways where we as physicians can connect with patients and educate them, guide them through misinformation, talk about policy, advocate for the profession, so many different channels that we can use. Whereas before, you would need to write an opinion piece in the New York Times and get it accepted. Now all of us can have platforms just like yourself. We could all have platforms where we could really make our voices heard. And I think that's tremendously important for every physician.
Yeah, and it's so nice to hear the beginning stages because we think now, like when we hear about Kevin Pho, like, oh, that has like millions of people that read this every month. And in the beginning stages, you were saying didn't really have like a blueprint or a vision. How did that look, just in the start for people that might be thinking, okay, I really want to use my voice. I'm not sure how to navigate. What did it look like kind of in your initial steps?
So it was very experimental. I think that the thing about social media today, even, I think that applies, is that you do have to run a lot of experiments. You put content out there, you see what works, see what resonates, what doesn't work, you stop what doesn't work, and you double down on what is working. So back then, I would write articles, some longer form articles, some shorter form articles. Sometimes I would just write one or two lines after an article that was published. So like different forms, and see what resonated and connected with my readers. Eventually, once the platform was built up enough where I had a significant readership, I opened up the platform for other physicians. And this is
Mhm.
probably 5 to 7 years after I started. And I realized that a lot of physicians, and not just physicians, I'd say a lot of healthcare professionals, most of them are physicians, but a lot of other advanced practice providers, nurses, patients, they would also have voices and stories as well. And I would have a big enough platform so they wouldn't have to start one off from scratch, where they can share their voice. And that has certainly helped the growth of Kevin MD to what it is today. Now it's that platform where healthcare professionals can really be heard, and not just share their story and their voice, but if they want to catch the attention of mainstream media, I've had plenty of people use my platform as an opportunity for that. So I think it's just been an evolution based on what readers want, and based on what my writers have to say. And I think that also mirrors other, outside of medicine as well. If you one of the things that I like to say is that in medicine, everything is like 3 to 5 years behind every other industry.
Mhm.
So if you look at trends in other industries,
Yeah.
if you look at media in other industries and see what direction they're taking, medicine is probably going to follow. So I also keep up with trends in other industries and try to apply some of those ideas and trends into medicine. And if you do that, you'll always be ahead of the curve.
That's funny because I was in the military and we always were about 2 years behind because we like to see what other people do, see how it works. And of
Hmm.
course, we always think the military is a little behind, but I liked their strategy because then you kind of let other people test it out. And even getting to know you, the first time I was on your podcast and just having our interactions, and just it's not what you do, it's like who you are. And that
Hmm.
is so amazing about like what you've created. And I also think it just mirrors the type of person you are. Like you've created this really safe space for people to truly feel heard in your authenticity and how genuine you are. And I'm just absolutely amazed at every interaction we've ever had, because that's something, once you help me to feel safe and heard, it's like, that's, well, I'm going to keep submitting here because this is somebody I truly stand behind. And I just wanted to say that as so much appreciation and just in awe about your level of compassion and advocacy. So thank you so much for that.
Oh, well, thank you so much for first off saying those words and also sharing our story. And one of the things that struck me is that, yeah, I think that the platform is a reflection of who I am. I think that I try to let people share their story. I try not to pass on judgment, and these are all qualities to being a good physician, right? So, when patients are in the exam room and they tell you their story, or if they share an opinion, and even if you don't necessarily agree with that opinion, I think they certainly deserve to be heard. And I think that, you know, we extrapolate some of these issues to kind of greater society when you have so much polarization and divisiveness. I don't think there's enough of that where you just value what the other person is saying, even if you don't necessarily agree with them. I think certainly most people do get to be heard, and I try to share those values on my own side as well.
Yeah, it definitely comes through. And it's so the depth of the different perspectives that you share. And I really value what you've created. It's unlike anything I could even fathom. And again, it goes back, when you just hear the name, I just would never, you don't know who to expect on the other side. And once you meet
Hmm.
them, it's like, oh my gosh, you're such an incredible human. And I have questions later I want to ask you
Yeah.
about how you stay grounded, but in terms of just kind of staying on that social media, we talked about how things evolved since you wrote your book, how social media, how you're keeping up with those trends, kind of the goods and the bads. Can you explain, what you've personally experienced or what, you recommend when it comes to navigating the pros and cons of being on social media?
So I think that whenever a physician considers having some type of presence on social media, they have to do so with a reason first, right? You can't just be involved with social media just for the sake of being involved with social media. And you want to go in with a certain goal. And that goal could be just educating patients, it could be just creating more of an online presence. So when patients or people Google you, you are more in control of the information that comes up. And of course, there's a whole advocacy piece where um, you want to share the profession, you want to advance the profession, you want to share stories. So go in with a goal first. And I think there's always a social media platform also that fits anyone's personality, right? So if someone's a better writer, then of course there's blogs. If someone is great on camera and video, then there's always YouTube. And of course there's podcasts as well. So I think there's a medium that best fits the strengths of any person. But before a physician goes in, they have to kind of go in with a goal first. And then there's always platforms that fit those goals. And then I think there's um, an evolution, of course, of online discourse, right? I think that you've heard so many stories, not just in medicine, where people can get canceled for saying something that is politically disagreeable with half of the country, for instance. I think that now there is a certain level of awareness that needs to be learned whenever a physician goes into the public, because if they get pushback, or if they get proverbially canceled online, that could affect them professionally. So I do think there are certain lessons that physicians should be able to learn before going online, and just being a little careful about what they say, because the repercussions that physicians have online, it is going to affect them professionally. So I do also recommend a little bit of caution whenever a physician posts something or posts some content on social media. I always say that whatever you say online, just imagine it being posted on a billboard right outside your clinic, right? Because
Mhm.
there is no hiding from it whenever you say something online. So I do think that there's that extra public scrutiny that physicians have when they're online that they should be aware of.
Yeah, that's funny because my filter is I always imagine that the president of the institution I'm working for reads it or sees it.
Hmm.
And
Absolutely.
with the risk, like the risk mitigation, that we always think a lot of physicians or people that do have a public platform or public identity, they say, you know what, too high risk to say anything. I'm not going to say anything. However, that's risky because then we
Hmm.
allow other people to control the narrative. And
Yeah.
what, how do you help challenge people to, allow themselves to learn to put themselves in the appropriate light so that they control kind of their own um, presence on social media or their reviews, or what are your thoughts on that?
Yeah. So I think that everyone has a varying thickness of their skin when it comes to criticism or pushback, right? So you have to know who you are, right? If you are very sensitive to what people say about you, then probably social media isn't the best place where you want to share your opinions.
Mhm.
I do think that if you do want to advocate, you do have to be prepared for some criticism. You have to be aware of it. You have to be comfortable with it. And sometimes criticism is the best way to sharpen your point of view, right? So know who you are, right? So if you're the type of person who doesn't like to be challenged, who doesn't like any criticism, then probably social media is not the right venue for you. So when it comes to advocating for the profession, right, there's a pretty um, fine needle that you have to thread, right? So the the feedback that I generally look for is that if I push an opinion that gets criticism from both ends of the political spectrum, from both the left and the right, from both progressives and conservatives, then I feel that then it's the right place I want to be, because politically I am, what they call you listen to Zubin Damania, kind of a radical moderate, right? So
Mhm.
the alt middle, right? So I'm actually the type of person who sees positives from both ends of the political spectrum. I think that the solutions that we have, especially in healthcare, the problems are so big that we do require solutions from and ideas from both ends of the political spectrum. And that's one of the things that I try to share that viewpoint on Kevin MD, where whenever I have a progressive point of view, I try to counter it with someone from a more conservative point of view, because I do think that ideas from both ends of the political spectrum have merit. And if I push an opinion that gets criticism from both sides, then I know that that's probably the place where I want to be, where I am threading that needle. I'm not certainly not always successful, and it's taken years to really thread that needle to be comfortable with that position. And it's something that you know I'm not always perfect. Sometimes I'll get criticism from one particular side, and that's certainly something I take back and I've learned from. And just kind of like I said, criticism is a great way to help sharpen your point of view.
Mhm. Yeah, it's so fascinating too because I would say I really am a sensitive person. I'm very introverted. And so I think it's funny to have a YouTube channel as an introvert, and to say, I was really sensitive to criticism. And your platform, I can tell, not only for me, but for the people that say, "Hey, can you review my article?" Now that I've been on your platform a few times, it's been really fruitful because then people that haven't yet been on your platform and say, "Can you read my article? Do you feel like it's appropriate?" And knowing that you like the stories and understanding how excited people get when they get to share their story on your platform
Hmm.
and how healing it becomes. And it's so interesting to see how we evolve, kind of what you said. It's like we get to share our voice, and then when you share your voice, for me, I put the things I looked at my articles in the beginning. It was like very things that weren't so sensitive, right? Like, like whatever. I have a
Hmm.
thought, I have a very an opinion I'd like to share about this topic. And then it gets a little bit deeper, right? And
Hmm.
I can see the evolution of that. I'm like, well, you're not sure you want to share this, but you know what? I'm just going to rip the band aid off. And then when people that I met that are sharing on your platform, it's like the next article that they want, I can see how it's impacting them. And then when a person writes an article that maybe somebody else is experiencing but doesn't want to write about,
Hmm.
then they get to heal.
Yeah.
And it's just mind blowing and amazing. And I'm just so grateful that you put yourself in that situation where then you create that safe space and you help people to navigate because you're open minded to seeing all sides of
Hmm.
the political spectrum or the personal spectrum. It just, it again, it is highlighted in the platform that you create.
No,
Um,
it's I'm so glad to hear that feedback, and no, I'm definitely grateful to you specifically, of course, for really sharing some of those intimate moments and having the trust in me and my platform for and for you to have that strength and confidence to share those feelings. So that to me is very important.
Well, thank you. And on your on the Kevin MD under the Kevin MD umbrella, you have your coaching and your speaking. Can you share with us like what do you enjoy coaching on and what do you enjoy speaking on?
Yeah. So, well, speaking has been kind of on the back burner, right, for the last like 3 years,
Yes.
3+ years during COVID. But before then, I used to speak, for the last 10 years, and really just sharing my story and talking a lot about the things that we're talking about today on this show. Um, I talk to a lot of physicians, and a lot of physicians want to know, why should I care about social media?
Mhm.
And I only hear negatives about it. I hear people getting canceled, people getting fired because of social media, and a lot of physicians see social media from a perspective of risk, right? They always hear it from their risk managers that don't do this, don't do that, you get fired, and it's very restrictive, right? So I just wanted to present an alternative viewpoint, saying, hey, social media has brought me to where I am today, and there's actually a lot of positives. And I actually go one step further. I think that physicians should have a responsibility to be on social media in a responsible way, because especially now since COVID, there's just so much misinformation and divisiveness, and all our patients get information from social media, and that's no and that hasn't been highlighted more so than during the pandemic. You have the virus itself, COVID itself, but now you have all the stuff about the vaccines that are out there. Should I take this? And there's a lot of misinformation that patients are getting from social media that we just end up have to clear up in the exam room. So I think that the more physicians, and no, not just physicians, clinicians, or any healthcare professional, the more healthcare professionals that are online where we can create a counter narrative of reputable healthcare information, the greater the chance that patients are going to read it and say, Dr. Poe says this, and hopefully I have that trust. The patients have that trust in me, where what I say or what my platform says carries weight, and they can think about that and counter. We may not change everyone's mind, but at least they can have that to counter a lot of the misinformation that they read on TikTok and YouTube and
Mm.
Facebook, because there's just so much misinformation, and the more misinformation that patients read, the harder it is for us to do our jobs in the exam room, because we just have to spend all that time countering all that misinformation
Mhm.
that they're reading online, and that just we could be spending it on something better.
Yeah, and I really valued, there's Dr. Carla Lester, who's a big TikTok. She's a pediatrician who writes on your platform as well. And we
Hmm.
got to know each other, and we talk about her perspective from
Yeah.
being she's very big on social media, and she talks about death threats
Yeah.
and things that she receives. And I find that there are, we have Dr. Oz for an example, right? He's a
Hmm.
person that can share information that's controversial, and I think that the more we can have people that are speaking up to kind of counteract, like you said, the other people that might have a platform that might have ulterior motives,
Hmm.
even with, I write on diet culture and that's influence and even how it's changed perspective. So if we have cultural beliefs such as diet culture that then are ingrained in us as people, and then we
Hmm.
bring it into medicine, but no one talks about the like challenging that narrative that's been around for so
Hmm.
long, then we just leave the status quo unchallenged.
Yeah, exactly. No, I completely agree. I think that you know, it is important, for us to make our voices heard. And physicians are realizing how powerful that is. And of course, in our sphere, where people, it's made a difference, obviously, in your life, but in all these other clinicians' lives who's written, um, even on my site or have their own platform, I think their eyes are open in terms of the power that they have. And it's not, physicians can't just throw their hands up and say, there's nothing we can do, but there is something that we can do, right? There is
Yeah.
something that we can act on. There are platforms that we can go on and make a difference.
Yeah, and it's interesting too because thinking about the next step is the physician entrepreneur, right? That's become a big thing as we combat burnout and we're increasing our autonomy in many ways. And as your platform, it's entrepreneurial. And then also when I'm looking and we're seeing these people that are changing the status quo, that even in their own groups of other physicians are saying negative things about this change.
Hmm.
And as I dissected it, I know one of my articles I just gave to you, so it's like my mind's blown because I'm like, why are they resisting and why are they trying to quiet people that are actually trying to change the trajectory of medicine in a more pro physician way. And can you just share your perspective, either from your personal perspective or things that you have gathered from your own observations about the physician entrepreneur and also the kind of intercultural support or things that
Sure.
are going on with that?
Yeah, I think that if you're 100% doing clinical medicine, no matter what field you're in, it's very, very difficult. I'm a primary care and home medicine physician. And if I had to do this full time, see like 20 to 30 patients a day and do all that charting and all the checklists, and I think that there was like some statistics is that if a primary care physician had to go through every single recommended screening test or counseling for every patient, it'd take up, something like 15 hours a day or something like that. And I think that doing that is very difficult. So you're getting, of course, more burnout. And the numbers before the pandemic is that 50% of physicians are reporting symptoms of burnout, and that number is going higher. So they're looking not necessarily to escape medicine, but they want to see what else is out there. And physicians are very linear in their training, right? Once we do pre-med, we do medical school, residency, and then fellowship, and then that's it. And this is kind of a linear path for like 10 to 20 years. And they may not be aware that there are other things out there that we can do with our degrees. So one of the themes that we have, of course, on KevinMD and my podcast is that we physicians are more than their degrees, right? And we've talked to doctors who are doing things, great things, not only in clinical medicine, but also outside of clinical medicine. They could be great investors. They invest, they could be media personalities. They can do real estate, and and people are starting to realize that one of the ways to combat burnout is to have a passion outside of clinical medicine. And that's not to say they didn't want to quit medicine completely, but they could realize, hey, maybe we could do medicine maybe half time, and the other half time I can feed myself and with another passion outside of medicine. And ironically, I think by doing that, you could probably stay in medicine longer, right? Because I hear about these physicians who um, they practically see all these patients and they spend 100 hours a week doing clinical medicine, but you know they burn out quicker, right?
Yeah.
Whereas physicians may be cutting back a little bit and doing things outside clinical medicine, and they could be practicing 10 to 20 years more, right? So I think that that's a lot of what we're seeing. I think a lot of physicians are being frustrated with the system. There's a lot of things that they can't control that is happening to them. So I think that's why you have more of these physician entrepreneurs, because as an entrepreneur, there are more things that you can control than you can inside of clinical medicine. And I'm seeing that as an avenue to fight the rising burnout rates that we see.
Yeah, and I'm just thinking about the burnout and all the things that you do. I think it's a very common narrative say, yeah, well, I wanted to have more control of my time and then I created this job outside of my clinical medicine and then
Mhm.
I'm doing both and then I'm getting burnout on both ends. How do you navigate all the different avenues that you're doing and prevent burnout in all different perspectives? Or if you've been burnout, how do you navigate those?
Yeah. So I think you only get burnout if you don't enjoy or don't particularly enjoy something that you're doing. So I always bring it back to that example where if you're doing primary care, 50 to 80 hours a week, that's probably a lot, because physicians don't particularly enjoy doing some of the less glamorous things of primary care, like prior authorizations and EMRs and dealing with administration, a lot of bureaucracy, right? But if you only were to only do that and see patients half the time, maybe like 16 to 20 hours a week, and then use that time to do things that you're passionate about, because the old cliche, right? If you're passionate about something, it's not really work, right?
Yeah.
So if you're spending the other half time doing something that you really love, and for me, of course, is like talking to people like yourself and various experts on my podcast, and having that platform and speaking and coaching, these are things that I enjoy to do, so I don't really consider that work. Of course, it's also giving me time to be with my family. I think that certainly is important for everyone as well. So I spend time with my daughters. My daughter is going to be a senior in high school, so I've been to every one of her soccer games, and these are things that also fulfill me as well. So having making that time for that balance, and realizing that medicine, when and I'm sure that your audience has heard this. So, when you die, what do you want to be remembered for, right? You want to remember for who you are, what you do, right? So no one's going to remember you for seeing that extra patient a day, but people are going to remember what kind of father you are, right? What kind of person you are. So I think that it's important to realize that up front. What do you want in your life? And having more of that control in terms of what you want is tremendously important. And I think that physicians, we're in a position where we can have that. We're very lucky in terms of our education, that what we do, our profession. We're all well paid. We're all in the top percentile in terms of income, and we all have that ability to take control of our lives.
Yeah, you just had an interview with the hospice physician, and I
Yeah.
shared it because I was like, it is everything what this platform is about with my burnout, suicidal ideation, things like that, and losses of people that were young early on in my life and dealing with anorexia, which is life threatening. It's like you just face death soon, which I think allows us to really, if we allow it to, teach us how to live better and to prioritize the things that matter. And as I know you, I thought you're so grounded. How do you how how are you so grounded?
Well, I don't know. You probably just haven't seen me when I'm all frazzled, right?
You're
So
welcome to share that aspect of yourself too.
no, I think it's because of personality as well. Like, that this is really kind of who I am, right? Very little phases me. And, you talk to a lot of doctors, they've kind of, if you go through medical school, intern and residency, no matter what field you're in, I think that you've pretty much seen it all, right? If you see people die in front of you, or if you see someone, have something of a severe medical event, and, a code blue or something like that. And if, I guess you get kind of desensitized to kind of some of the other less severe problems that you have in life. But I do think it's also personality related,
Yeah.
because social media kind of reflects who you are. I also wanted to get back to what you said about the hospice doctor Jordan Grummett. I
Yes.
had him on my show, and he has that book where he gives financial advice from the perspective of a hospice physician. And there was one thing that struck me from the interview. He says that whenever you're about to die, right? Not to get too morbid, but when you're about to die, you always wonder, oh, what do I wish I could have done with my life, right? People always have regrets. And
Mhm.
one of the points that he made that really resonated with me was that you just want to move that conversation up earlier on in your life. You
Yeah.
don't want to wait till you're on your deathbed and
Yeah.
ask yourself, what do I regret in my life? What could I have done more with my life? When you're in hospice, or when you're about to pass, that's not really the time you want to have that conversation. So he's a big advocate of moving that conversation up earlier on your career.
Mhm.
So when you do pass, you don't have any of those regrets. And I think that's a lot of that's a point that I think a lot of physicians, they need to realize that, hey, we can have that conversation now, where we can get more out of our life, and not have any of those regrets later on.
That's exactly when I reflect back to again my residency experience and like what I would say the gratitude I have for having the suicidal ideation was that recommitment to life every day. And it led me to create a rotation for myself, which was how to live a good death and to spend time with people. Because I feel like if we do spend time with people, and I think in medicine, what I notice is that we often have limited opportunity to really hone in the skills on how to sit with people when they have a difficult diagnosis.
Hmm.
And as me, when I was dealing with medical complications from anorexia, I was often left alone because people don't know how to talk to you. And I was like looking at my heart rates in the 20s, and I'm like,
Hmm.
no one's talking to me. But I do
Yeah.
recall people that did.
Hmm.
and how they treated me like a human, and
Yeah.
how much of our healthcare system has brought the human out of the healing in all regards, not only as the patient, but also the people that are involved, whether it's admin or the physicians or the nurses or every single person involved. And I feel like that's the key aspect of medicine that's missing in the Western culture. And I can see a lot of people are trying to bring in from different cultures, bringing in more of that humanistic type approach to healing. Are you observing that as well?
No, I do. I think that um, you just always have to realize whenever patients come and see you, whether in a hospital or the exam room, it's often at the worst time of their lives,
Mm,
right? And for that one patient, it is their worst time, and it doesn't matter whether that's that the 20th or 21st patient of the day, and you've seen already 5 cases of the same thing during the day. But to that particular patient, it's the worst moment of their lives, and you just have to be completely focused and present on that one patient that is in front of you at that moment. So I do think that, yeah, I think that we all have to take that moment just to pause. And sometimes if you're having a bad day, just pause before you go in and realize that, hey, you have to be present no matter what the situation is.
and I also, speaking of the pause, I was thinking as such an advocate and all the things that you are creating and how much you're supporting others, what's the best way that we can support you?
Well, I think, thanks for asking that question.
Yeah.
Listen to my podcast, visiting my site, those are the best ways, really. So I think I do have that daily podcast, the podcast by KevinMD, where you can search for it on any of your favorite podcast networks. You kind of read the stories on KevinMD as well, where not just listening to me interview just people across the country, but just like I said, listening to the stories that people are sharing. These are very vulnerable stories. Sometimes they share a lot of intimate detail, and these healthcare professionals are opening themselves up to you. So visiting it, reading, commenting, if you want, and just realizing that, hey, there are other voices in our healthcare system. I think our healthcare system is pretty siloed. Physicians are, kind of talk to other physicians, and same with nurses and other um, corners of the healthcare world. But I think we need to realize that we need to all talk to each other, because all of us have essentially one goal, and that's really to help patients. And sometimes we need to hear from those other perspectives in order to better do that job.
Yeah, I'm of course going to make sure I link everything down below. And it's so important. I learned from podcasts. I obviously don't have one. I love YouTube because I don't know, it's something about the visual aspect for me. But to make sure to rate and review your podcast so that other people can also find it. What are your priorities in your life right
Well, the first has to be family, my wife and 2 daughters. So that's the first priority. The second is really doing what I'm doing right now in terms of speaking to you and speaking to like other physician personalities, and really continuing my platform where I can just keep doing all the things that you say that I'm doing in terms of really sharing those stories and voices. Because I don't need to tell you that, like, I think that's tremendously healing. It's helpful because there's so many ways that we can make a difference in not just the lives of clinicians, but the lives of patients as well. So that's really going to be my continuing passions for now.
now? Kind of sneak peek a little bit about your extracurricular interests from Bootstrap MD. We'll link that interview below. But just so that it's always fun, I think, to get to know people outside of medicine. And just, I won't give away what interest you share, but can you share a little bit about your outside interests outside of medicine?
I don't even remember what I said in that interview.
It had to do
There's
with
so many of you.
football.
Oh yeah. Yeah. So no, I'm obviously a big sports fan. I follow New England Patriots, and big Celtics fan. But right now, I think that um, taking and follow my daughter along to her soccer journey. She's a varsity high school soccer player, and that takes up,
Wow.
as all the other varsity soccer parents know, it takes up a lot of time. So between my family, between doing the podcast, the blog, and doing primary care, that's really taking up a lot of my time right now. So not too much things outside of that right now.
Yeah, well, that's amazing. I remember I was in those club volleyball teams, and
Yeah.
it's just like another job. So
Hmm.
I can't even mentally imagine what your day looks like because we see everywhere you are and everything that you're doing. It's we always talk about what people are doing, but to me, it's like, yes, I'm super grateful for what you do. I'm even more grateful for who you are, which we can see again in what you do. And I love at the end of your interviews, you always say, and kind of what is your last, insights and wisdom that you'd like to share with the audience? So I'd like to offer that same question to you.
Yeah. So, nothing that I haven't said before. So make our voice heard, right? So we don't have to suffer in silence. We don't have to keep our stories hidden. So to all those healthcare professionals, share your story, help the profession, help your patients, and you can only do so by making your voice heard. Whether it's shows like these, going right on not just Kevin MD, just right, at whatever platform that you choose, newspaper articles and television interviews, but just make your voices heard. So if you want to make a difference in the profession and make a difference in your patients' lives, that's the best way to do that.
Well, thank you so much. It's been such a pleasure. I'm so honored and grateful that you accepted my invitation to join me today. And I just can't wait to see what more that you're doing and support you. And just am extremely appreciative, again, not only of what you do, but of who you are. So thank you so much for being here.
Well, thanks again for having me, Jillian. It was great.
And thank you for the audience for being here. Make sure to comment below. Check out Kevin. I'm sure that everyone knows Kevin MD, but if you don't, get your tushes on over there. Make sure you listen to the podcast, rate and review, and come back for more.